COPD stands for chronic obstructive pulmonary disease, which is a chronic respiratory condition characterized by persistent airflow limitation that is not fully reversible. The two main forms of COPD are chronic bronchitis and emphysema, although many patients with COPD have a combination of both conditions. Here are some key points about COPD. Causes. The primary cause of COPD is long-term exposure to irritants that damage the lungs and airways, most commonly cigarette smoke. Other factors that can contribute to COPD include exposure to environmental pollutants, genetic predisposition, respiratory infections, and certain occupational hazards. Pathophysiology. In COPD, there is chronic inflammation and narrowing of the airways, bronchitis, and destruction of the lung tissue, emphysema. This leads to airflow limitation, difficulty exhaling air, and reduced oxygen exchange in the lungs. Clinical features. Common symptoms of COPD include chronic cough with or without sputum production, shortness of breath, especially during physical exertion, dyspnea, wheezing, chest tightness, frequent respiratory infections, fatigue, and reduced exercise tolerance. Diagnosis. Diagnosis of COPD is typically based on a combination of clinical evaluation, lung function tests, spirometry, imaging studies, chest X-ray, CT scan, and assessment of symptoms and risk factors. Spirometry is essential for confirming airflow limitation and assessing the severity of COPD. Management. The management of COPD aims to relieve symptoms, improve quality of life, prevent disease progression, and reduce exacerbations. Treatment may include bronchodilators, short-acting and long-acting, inhaled corticosteroids, pulmonary rehabilitation programs, oxygen therapy, smoking cessation programs, avoidance of environmental pollutants, and vaccination against respiratory infections. Prognosis. COPD is a progressive condition, and its course varies among individuals. Early diagnosis, effective management, smoking cessation, and lifestyle modifications can help slow disease progression, reduce exacerbations, and improve outcomes. However, severe COPD can lead to significant disability, respiratory failure, and increased mortality. Regular monitoring, adherence to treatment plans, and collaboration with healthcare providers are essential for managing COPD effectively and optimizing long-term outcomes.